Can you hear me? Why do you see no audio? Why do I see no audio? Can you hear me? Well, that's really delayed. Why do you see no audio? Why do I see no audio? Can you hear me? That's really delayed. Why do you see no audio? Why do I see no audio? Can you hear me? That's really delayed. Why do you see no audio? Why do I see no audio? Can you hear me? That's I have no video. I have no video. I have no video. I have no video. This is a feedback loop between the computer when I'm saying the delay and YouTube. I have no video. This is a feedback loop between the computer when I'm saying the delay and YouTube. I have no video. This is a feedback loop between the computer when I'm saying the delay and YouTube. I have no video. This is a feedback loop between. Alright, I turned my audio off. It says I have one person watching. I can't tell if that's supposed to be me or not. If you, or whoever is watching, can comment. If you can see me, that would be awesome. Let's see. Come on! Alright, let's see here. What am I doing? Whoa. God, there's such a delay in audio. God, there's such a delay in audio. God, there's such a delay in audio. And a delay in video. God, there's such a delay in audio. And a delay in video. Hello, world.
Such a delay in audio and a delay in video.
Alright, so I'm just going to get into this. And let's see. We got nobody watching at the moment. That's okay. I'm almost going to ignore YouTube and go from there. So sitting back with my potato camera, my pour lighting, and a Coney Island hard root beer. Because I like me some root beer. Want to kind of go on a little rant here on my wife and some of her medical issues and the existence of I don't even know what you want to call it, just retardation in the medical community. Let's see. Posting this to Facebook. See if I can get a couple of viewers to come over. I'm not super confident, but anything's possible. So, anyways, can't tell the difference between some of these statistics. I don't do this much, hardly any live streaming stuff, so I just don't really know what I'm doing. But for the statistics and analytics, it shows one person watching and 0.5 messages a minute. But the only messages are the ones that I typed. And doesn't really make a lot of sense to me, but that's okay. Whatevs. So anyways, wife has been having a little bit of medical issues going back. Well, let's go back to the way back. So about 2 years ago, she had it's like a potato chip, Doritos or something like that. She was eating, get jammed in the gums of her back. I think her back farthest left molar. So just a little tip of the potato chip gets jammed in there. Bugs it. She tries cleaning it. She doesn't know it's jammed. She just knows that there's something jammed in there. She can't get it out. Can't get it out. Ends up going to a dentist. They look. Everything looks normal. Okay. And she's insists. So they give her an X-ray and they look. There's a giant spot there. It was on this side. And so they go and they dig, and there's a potato chip there. Sometime later, pain comes back, and she gets in. I don't know if she had an infection at the time or an abscess, but she has some tooth pain. She goes in, and there's a cavity. I'm pretty sure they fill the cavity. Goes back again sometime later. tooth pain, same tooth pain, only it's like devastating tooth pain at this time. And it turns out that you're going to need a root canal. And I'm like, geez, that's pretty harsh, but okay. So they give her a root canal in the back. I need to invert this image. I keep pointing to the wrong side because I'm looking at myself. Anyways, so they give her a root canal, and everything seems to be okay. They don't put a crown on it. They put a temporary filling in, and they want to just wait and see how it goes. And then I think they end up putting a temporary crown on, and then it ends up cracking or coming off, so they end up fixing it. Fast forward a few months, they kind of work on it, trying to get stuff taken care of. Keeps having this constant pain. And according to the way I read online how nerves work is if you have a nerve branch or nerve chain, let's see, you get more lighting on this side, I guess. So you can have a tooth here that's killing you, but it can actually be the tooth next to it. And because the nerves come down and they tie in and they go back, anything along that line can have like phantom pain, but it's the pain, it's a problem next to it or somewhere in that area. Anyways, so she ends up getting a root canal on the tooth next to the tooth she had the previous root canal. They take care of that one. They end up putting a crown on that one. She's had that one for a while. This is about maybe a year ago or so. Pain comes back. They give her antibiotics. Pain goes away. It keeps coming back and forth. Fast forward a little bit farther, about 10 months ago, she on and off she had an ear infection, and the same side that they went to the ENT or the doctor or whatever, and they were like, oh, that's kind of rare for adults to get ear infections like this. She's like, yeah, it's like knives stabbing me in the eardrum and stuff. And I'm like, pretty harsh. So we use some like home remedy type stuff to kind of just take the edge off and ease the pain a little bit. And of course, guess what happens? Antibiotics. It goes away for a while. Then the tooth pain comes back, and it ends up coming back and going quite a bit. 10 months ago, I want to say it's like Saturday morning, and we're having coffee in the morning. We slept in a little bit, and it's probably 9:30, maybe 10. She's laying down. Now, a year ago or 2 years ago, she had a deep bone contusion. She bruised her kneecap and the bone underneath it. She was at an event, and there was some dancing, and she went to go slide on the floor. No alcohol involved, but she just went to go slide on the floor, kind of like you see Elvis and some of these other people do, on her knees. And the floor didn't give, it's concrete, and she didn't slide because of whatever she was wearing. I don't know what she was thinking. She was having a good time. Anyway, she smashes her knee into a concrete ground. It stiffens up, swells up. She ends up having to do 6 weeks of rehab, and she's in an air crutch for a while, or an air cast for a while, or a brace of some kind. And it was 6 months before she was kind of back to normal. This is all on the same side of her body. Now, 10 months ago, we're having coffee. Ever since she had that rehab on her leg, they tell her, oh, you need to stretch. She's already pretty limber, but you need to stretch. One of the ways they have her do is lay on her back, elevate her feet, and do kind of a butterfly type deal, stretch the groin tendons and muscles and ligaments, and keep it all kind of loose and stretch the low back. So she's laying on her back in the living room. I'm drinking coffee. Then I look over. She's kind of doing one of these numbers where her hands are cramping up and everything, and I'm like, you all right? And at that point, she kind of like seizing and spitting up and stuff, and I'm like, okay, so it looks like an epileptic seizure or an epileptic fit, or a severe case of multiple sclerosis or cerebral palsy or something where there's full body convulsions. And You know, but she's conscious. She never loses consciousness, but you can tell she's not in control. So and she does this. She's seizing for probably, or convulsing for probably 30, 30 seconds, 45 seconds. At which point her body just kind of is exhausted, and I'm not going to say relaxes, but just kind of gives out, and she gasps for breath. She was able to have really intermediate short breaths during this time. So she does this. I'm kind of like, okay, something weird's going on. So I do what I can to sit her up. She basically has no ability to assist me assisting her. You know, help me, help you type deal. She can't. She's either too exhausted or lack of controls, but because she was doing full body convulsions, you know. If you've ever been shocked, not just like, ow, that was a shock, or 9 volt on the tongue, but like really shocked, it causes full muscular contractions. You know, you're like uncontrolled. You're just cramping down as hard as you can. You don't have control. And or if you've ever used a TENS unit, that they put the patches on the muscles, and the muscles twitch and everything, and just kind of causes you to twitch. Anyways, so that happens. I get her up on the couch and sit her up and kind of wipe her face because she's got drool and spit and stuff and everything from the convulsions. And I'm kind of wigged out. And after about 30 seconds, they start all over again, or about maybe a minute. There's probably a minute in between convulsions. So this happened fast forwarding a little bit, this happened for about, from about 10 o'clock, 9:30, 10 o'clock to 5 p.m. On and off like this, full body convulsions. So after this happens second time, making sure her tongue she's not gonna bite her tongue. I don't want her bleeding and choking on it. I don't want her having any issues. So I'm keeping her up, and I'm treating her like she's having a seizure, and I don't have extensive medical training and stuff, but I've taken some first aid classes, and I've paid attention in some advanced first aid type stuff. Not super advanced, but a little bit, and I read a lot. And so anyways, so she's just having this on and off. So I work at a hospital, and I call we have a central operator at the hospital, and they receive all incoming phone calls to the general numbers, and then can get a hold. I want to get a hold of my doctor, and they'll, okay, who are you? What's your birthday? What's your doctor's name? And I'll patch you through to their office or whatever. Or hey, what time does this close? They can route you anywhere. So anyways, I call them and said, hey, can you route me to the ER? Well, of course they want you to play 20 questions. So I get them 20 questions, and they patch me to the front desk of the ER. And because you would think the ER is super busy, they got stuff going on, but they're never super busy. But anyways, so they route me to the ER, and I tell them, hey, I work there. My wife's having epileptic type seizures. I don't know what's going on. All she's had to eat is coffee. Or eat or drink, consume. She had, nothing else. I'm going to drive her in, and if you want to prep, so I just want to minimize delay. And they're like, okay, we'll get the paperwork kind of started or whatever, and we'll see you when you get here. So I go to get her up, can't do it. Can't get her up, not enough control. She's having fits and everything. So if I end up calling the 911 non-emergency number and say, hey, I need an ambulance, my wife's got issues. And so they show up, they kind of come in the house. The first thing they kind of do is they're kind of eyeballing you, thinking, drugs, you guys are on drugs. She had an overdose, too many drugs. They don't say that, but it's implied, you can tell. And so they want to know all the medications she's on. I tell her. I think at the time she's just on an antidepressant. I think that's it. She's on antidepressant. Other than that, we take vitamins occasionally, herbal type stuff, but mostly it's like curcumin, which is an anti-inflammatory, and that's just kind of as needed. We're not into crazy herbalistic stuff, and we're not potheads, and we don't do hard drugs. We enjoy alcohol, but we're not raging alcoholics, not by my standard, anyways. Just because I don't rage much, but I'm just kidding. Anyways, so they go and they're having trouble getting her to get into the stretcher because she has no motor control and convulsing and everything else and stuff. So I kind of help assist them, but there's plenty of them. I mean, I want to say the fire department shows up every time the ambulance is called because they're faster and they're medically trained. And technically, I'd rather deal with the fire department anyways. They're usually pretty level-headed guys who know what they're doing, and they spend all their time training for this stuff. I'm not knocking ambulance drivers or ambulance companies and everything and stuff like that, but they're specialists who specialize in one aspect, and I know they have to keep up credentials and certifications and everything else, and they're more than qualified, but they're not public servants. They're private operators, and it's some of that stuff makes a difference. So people act differently when they think they're accountable to the public versus private. Anyways, fire department shows up, super helpful. They ask a bunch of questions. Ambulance shows up as well. They all basically help get her on the gurney. My wife's freaked out when she's not convulsing. I'm trying to keep her calm, trying to talk to the people, get her into the ambulance. The ambulance wants to get a hard line in. They want to put an IV in for hydration purposes, and if they have to give you anything, then they can easily inject it into. I don't know if you've ever seen you have the IV bag, then you got the line that comes out, and it's usually got a Y in it. So as the line comes down, pretend this goes to an IV bag, comes down, then they can inject into this one, and then it'll go down into, if my arm was a hose, it goes down into the hose. So anyways, it's just easy to do and add medication into your body. And anyway, so they're trying to get the hard line, and my wife's like, spitting up and convulsing and trying to gasp for breath and moving around, and her arms are cramped and everything else, and she can't communicate very well. It's literally like forcing speech. So what happens next is she told me this after the fact, because I didn't get to ride in the ambulance. I had to meet them up there. So this is also one of the reasons I think that they were suspect of drugs and drug overdose or whatever. So she tells me after the fact that she was spitting up and everything. She wasn't spitting at anybody. She was just, coughing up and spit on her face or whatever. Not the driver, but because they usually have they go in pairs. But the other person basically yelled at my wife and told her to stop spitting on him, or he's going to restrain her. Well, she's already strapped down because they don't want you falling off the cart. That's a insurance, or that's a liability. And he's yelling at her, and all she can do is mutter, "I'm sorry," and basically apologize under her breath as she's convulsing and stuff. And then the driver has to turn back and tell him, "I don't think she's doing this on purpose," And it's kind of like, duh. So anyways, they get a hard line, or they give her a shot of Benadryl, thinking, okay, maybe it's a reaction, or overreaction, or overdose, and the Benadryl is gonna block, and it's gonna antihistamine type stuff. Anyways, so they get her. I take off. I shoot up to the hospital. I drive to the hospital 5 days a week for work. It takes me about, where we have to park, it takes me about 8 to 10 minutes to get there, depending on traffic and lights. And we usually have to park a block away, so it takes me another 7 to 8 minutes to walk from where I park to the hospital. So, anyways, because I'm not working, I just drive and find a parking spot pretty quick. So I drive there, I park, and I wait, and I beat the ambulance there by probably 10 minutes. I have no idea why. So I'm waiting around. Now they don't want to let me back. They don't want to do anything. They want to get her transitioned and, to make it as smooth as possible. But they're running drug tests. They're testing for overdose on anything standard. And everything comes back clean. Now they're perplexed and a little worried. And I'm like, oh, okay, that's good after the fact. So anyways, let's see, it's like I said, it's been almost a year. So they don't know what else to do. They end up giving her a couple different things. She eventually mellows out, I think partially because of exhaustion and who knows what else. About 5 o'clock. Anything at our ER, if you show up for a paper cut or a knife stuck in your head and you're still alive, you're looking at a 3-hour wait, minimum. If there's nobody ahead of you and no one behind you, you're probably looking at about a 3-hour wait. Partially is because they want to be thorough, and I have no idea the other reasons. I just don't know. Anyways, so we let her go. So over the past 10 months, she ends up getting 3 MRIs, an MRI of her head, an MRI of her low back, because she's saying her low back hurts, her and her hips and stuff like that. And so MRI of her hips, MRI of her low back and low spine, and an MRI of her head. And all MRIs come back clean. They end up doing a sleep deprived EEG, where they basically say, go to bed at midnight, you have to get up at 4 a.m., and then you come in and they put all the probes on your scalp. They have you lay down and do whatever they do. They flash some lights in your eyes and make some weird noises, and they record your reaction. And they're looking for like epilepsy or any weird anomalies. So this happens. It causes a fit. That's what they're calling it, or an anomaly, and or an event. That's what they call it, an event. And so this event happens, and she's. I can't even replicate it without just being comical and offending people with mental handicaps, which I don't want to do. Anyways, but nothing shows up abnormal on the EEG. So her brain waves are normal. So this is not epilepsy. This is not a brain source issue. There's something else going on. That's as much as this department can do. So they recommend her to go into pain, med, and rehab, which is a department that specializes in things that are just basically pain physical med and rehab. So it's basically like a pain clinic type deal. So anyways, but they're booked out 6 or 8 months, long time. So they get her on the books, and eventually they end up having an opening, a cancellation or something. So they get her in. Doctor's super cool. Mellow, wears a bow tie. It doesn't look like he would normally wear a bow tie, but whatever. Smart guy, pretty cool guy. And after several, talks to her several times, try to get down to the source of it, goes over stuff. He actually takes some personal accountability and not just having a nurse get back to him, but actually calls back. We go back in, re-looks at the MRI, which was of her low back and spine, which was taken 4 months earlier and was given the no problems, everything looks normal. Looks at it and goes, well, this is not normal. You have these discs here, and the front of the discs, your spine's got a curve to it, and it looks kind of like an S. The front of the discs are deteriorated a little bit, putting a little bit of compression, not much, but something. And then where the nerve roots come out, so you have your spinal column that comes down like this, and it's a column. Then you have your nerves which run through it, and then you have the discs, and then the nerves basically come out the side like this, and they go out to hips, legs, whatever. So where this joint is, the nerve root on both sides of this one disc, there's fluid sacs built up and build pressure, and it's putting pressure on the nerve column itself in here. So from a top-down point of view, it's putting a little bit of pressure, but it's not pushing up against anything. But it's not normal; it's abnormal. And so, anyways, he's like, "This isn't normal." So he puts her on some gabapentin, which is kind of a painkiller, nerve blocker type thing. It does more nerve blocking, and they end up putting her on a anticonvulsant type of thing. Anyways, they put her on all this different stuff. It makes a little bit of a difference. I think actually her regular doctor put her on this stuff just because it's kind of like a go-to drug. This doctor says that's the minimum we put for people with having ear issues. We put you on this. So they raise the dose. It makes a bit of a difference. It's been 10 months. It has not helped. I mean, it's helped, but it's helped symptoms, not issues. So she's also got went and got a epidural shot in her low back and a steroid injection in there. And that helped the inflammation come down a bit. It helped a bit. It did not help a ton. So my wife's life over the past 10 months has been get up, pack your low back in ice, occasionally have tooth problems that are a killer, just like anybody knows who has ever had tooth problems. Pack your low back in ice, lay on it, get ready to go to work, come home at lunch, pack the back in ice, go back to work, come home, pack your back in ice, try to eat something. Occasionally she goes to some meetings and just local groups or whatever. And if she can make it through one, great. If not, she might have an epileptic fit in the middle of it, and I have to go get her. I've had to go get her from work several times, or me and another coworker have to carry her out. Her boss has not been the friendliest about this, but it's a medical emergency. I don't know what else to say. I mean, she could lose control and fall down and hit her head. So, anyways, it's kind of a long way around and stuff and everything, but that has been her life for 10 months, 8 months at least. Just literally no social life, almost no exercise, no anything special, depressing, pain, pack everything in ice, and just kind of deal with it. So, starts having tooth problems again. It's just killing her. She's been dealing with this dentist trying to get it fixed. He can't figure anything out. They take an x-ray. They can't see anything. He's pulled the part of not the one with the cap on it, but the root canal that had the filling and the temporary cap or whatever. Pulled that off, cleaned it out, looked in it, put it back, couldn't find anything. Put her on antibiotics. She's been on antibiotics for on and off 5 times over the past year, maybe 2 years, just for this tooth issue and the jaw and everything. At least 5 times. It might have been more. Anyway, so she goes and deals with it one more time. He's like, puts her on the antibiotics, and usually after 2 or 3 days, swelling goes down. If there was much swelling, and the pain goes away, and it starts to get better, and then they can go in and do something. So we put her on just a standard antibiotic. It didn't really do much, and she had significant swelling. I mean, it was like her whole side of her face was just really swollen. Side of her face, jaw, neck was all puffed up. And not just like I'm retaining some water's puffed up, but like infected or, I don't know, puffed up. I've seen boxers with less swelling. But anyways, so she goes back to the dentist, and he's like, oh, you should have had something better. I'm going to put you on a stronger antibiotic. He did. It helped a bit. He says, if this doesn't do it, go into same-day care or go into the hospital and tell them your dentist wants you on a IV antibiotic. You have an infection, and the antibiotic isn't getting into the root or isn't getting into the cavity. Or when I say cavity, I don't mean dental cavity. I mean like void, a space where there's bacteria festering. So she's on that antibiotic for a while. The swelling goes down, does not go away, but goes down, and goes in and looks again. And she's just like, I've had enough. Pull the tooth. Just pull it. And oh my God. Hold on 1 second. Sorry, I gotta take this. Anyways, so she goes to get it pulled. He pumps her up on Novocaine, tries 3 times to just pull the tooth. She's in excruciating pain. Now keep in mind, this is a tooth that's already had a root canal done, so the nerve should be dead anyways. And she's had Novocaine. Can't pull it. He's like, look, you need to see an endodontist or oral surgeon. He's like, I'm just not set up to do. He's not an oral surgeon, basically. So she's kind of depressed, but she's still on the antibiotic and everything and stuff, and it's just getting worse. The swelling is not necessarily there, but the pain is just nonstop, and it eats at you after a while. So she ends up going. I ended up pushing her and said, look, before I had my dentures put in, if you haven't seen those, I have videos in the. I got a video series all about dentures and stuff like that. I kind of walk you through my experience with them. If you have any questions, you can definitely go down the live chat and ask any questions or something like that. Or if you have any comments. Anyways, I don't want to bore you and take up a long time, but I want to finish this story, and I have a tendency to ramble, so feel free to interject. But anyways, so before I had that done, I had 2 teeth that were just worse than the rest. And my teeth would just get brittle, they would break off, and then they would get infected because they're exposed and everything else. And I would try cleaning them the best I can, sanitizing them. I'd get abscesses, I'd lance them, and I finally had enough. And I had a dentist recommended to me who was not afraid to give me Novocaine. And he ends up giving me 3 or 4 long-term or long duration shots of Novocaine, something that's going to last a while. And he ends up giving me 6 or 7 shots of fast-acting Novocaine, and he was able to get the 2 teeth pulled. And they were virtually broken off at the gum line, a little bit sticking out, and I mean, it was bad. And I have bone loss because I let those go so long. So I don't know. It's a shitty comparison, but you can kind of see. Yeah, I can't really compare. Anyways, the bone on the one side is definitely smaller. As far as your jaw goes, it's a significant amount, and it's from bone loss. And if I am pretty sure if I were to go get studs put in for my dentures, I'd have to get a bone graft. They cut your gums open, fillet it open. They put in a mesh that allows the bone to grow into. You cover it up. You come back in 6 months. They check your bone density. Blah blah blah. And if eventually it's good, they can drill a hole, thread and tap the hole, and then thread a stud in, and voila! Eventually, like a year later, you can attach dentures to it. And it's funny because the studs are like $1 a piece on Amazon for titanium studs, and they cost between $1,100 and $1,500 to install them. Whatever. It's good to be professional, I guess. Anyways, I wouldn't want to do it myself. It just seems kind of high. But anyways, so I push her to go see this guy, and if he can't do anything, then I said, hey, go see the oral surgeon that did my extractions. They're easy to work with. They know what they're doing. So she goes to the first guy, and there's two dentists, they're partners, and one of them he just booked up. So the other one takes it, the one I haven't been to. I met them both briefly a couple years ago, and they're pretty nice and seem pretty knowledgeable. But anyway, so he gets the appointment. My daughter and I are waiting in the waiting room. She's in there more than an hour. They did a CT. Oh, sorry. I got to back up. So she's been dealing with the doctor. Doctor's like, or the dentist, and the dentist is like, look, you need to see oral surgeon or something like that. So she ends up going into same day care or express care or whatever you want to call it. Here it's same day. It's not the emergency room. She goes in to the hospital and is like, look, my face is swollen. I'm having trouble swallowing. I'm having trouble breathing. I'm just in excruciating pain, and the pain is so much that's causing my back to hurt. I already have back issues, and just, and the doctor or the nurse takes her into the room, and she kind of explains what she's been going through with the teeth and the root canal and all this stuff explains it to the nurse. The nurse tells her right off the bat, look, the doctor's probably not going to do anything, just to let you know. And she's like, well, I was recommended by my dentist to come in and stuff like that. And she's like, okay, well, I'll go get the doctor. So, after doing all the basic stuff when you go in to see the nurse, the doctor comes in and basically says right off the bat, I'm not changing your prescription. I'm not going to give you anything. And we're not going to treat you. And my wife's like, look, my dentist said if this antibiotic doesn't do anything, I'm supposed to come in and get put on an IV antibiotic. And she goes, it's like, my wife doesn't get off work till 5, and she struggled through the day just to get through work. So she goes, and the doctor says, we don't do IVs after 5 o'clock. And I'm like, okay. I mean, I can only assume that if this is a medical emergency, they would refer you to the ER. I know if they can't treat you, they usually refer you to the ER. I've seen it happen with my wife, and I've seen it happen with other people at this hospital and at this same day care and at this ER. Instead, she goes, my wife's kind of upset. She's been in pain a long time. But I don't think she was acting irrational. I wasn't there. So I can only look from one side. But being a husband, I have to take my wife's side. It's the right thing to do, and it makes sense. And I've known her long enough. She's not a liar. So anyways, and she's not a drama queen. So she's like, look, he told her, I need to go in and get IV antibiotics. And the doctor said, we don't do that after 5. And she goes, well, what, you do if somebody had an infection in like their throat or something like that, and they were swelling up and they couldn't breathe, and she goes, the doctor's response was, what are you getting at? My wife's like, she didn't know what to say after that. I'm sure she said something and stuff, but so me personally thinking outside the box, and I don't know if I'm the exception here, but I would think, let's see first of all, if the doctor spends any time and effort trying to get to the bottom of this and figure out what's going on, it's a benefit for everybody. The patient gets treatment of some kind or diagnoses. The doctor gets paid for doing it, and the hospital makes money on the patient for being there, the doctor's time, and any tests that get done. So it's a win-win situation if it gets resolved. So I don't understand the whole idea of we're not going to treat you. We're not going to do anything. Just whatever. So my wife, responds and basically says, look, I can Google this and I can look up that these are likely issues. I've already been on antibiotics for infection. I think I need stronger antibiotics, or he recommended IV antibiotics. I need something to happen. And the doctor is basically just, I'm the professional, you don't know what you're talking about type idea. And my wife's like, look, I understand, the mentality's screwed up, the system's corrupt, you don't even have that much education in nutrition, which is kind of a insult to the doctor, but true. Doctors typically don't have that much nutrition schooling. Most standard doctors, if they had more than a semester, they're above average out of everything I've read. So, and out of the doctors I know. But anyways, so the doctor basically stormed out. Didn't say you're dismissed. Didn't say goodbye. Anything. Just stormed out. We're not treating you. You can leave anytime. Um, that was it. That was it. Wife comes home, sore, having trouble breathing, having trouble swallowing, pain causing her to go into these full body convulsions and fits. Comes home, morally distraught, and so I'm talking to her and trying to comfort her and trying to find out what's going on. Just a horrendous situation to begin with, and so I post a little rant on Facebook. You can follow me on Facebook if you want and read the rant or whatever. But I ended up getting in contact with one of her high school friends whose significant other is a Navy flight surgeon or an ex-Navy flight surgeon. And apparently a lot of them are cross-disciplinarians. They study multiple things because it could be anything. You could have a soldier who needs oral surgery in flight. So basically he's like, hey, you need to do this, this, or this. These are the issues here. You need to do that. So after the doctor refused treatment, basically, I push the issue. I stay home from work. We contact the dentist that I went to. They do a CT scan on her head. Turns out that it had 2 root canals that were screwed up. Either he screwed them up or something happened after the fact. But they had multiple spots where a bacterial infection was setting in. Part of the teeth were cracked in a couple different spots horizontally, allowing septic, so they weren't sealed all the way. And there was bone decay. So she had bone loss from the infection, which means that they were thinking at least a year she's had an infection in here. So she goes and does more research and everything, and it turns out that there's lots of evidence saying that if you get an infection in your teeth, it gets bad enough and gets into your bloodstream, it can cause all kinds of problems, everywhere from spinal fluid and brain swelling to nerve issues, lots and lots of problems. And the hospital seems negligent here at this. At minimum, they should have referred her to the ER, or, the only thing the doctor did is the doctor offered to run white blood cell count. And white blood cell count would show the presence of an infection, possibly, but she had been on antibiotics for more than a week, and they were stepped up from standard antibiotic to a stronger antibiotic. So whether her white blood cells would have been elevated or not, my wife is like, look, I don't want blood tests done. I want you to look and do something. And they pretty much were just pissed, at my wife for being she's like, look, you're just upset. My wife's like, yeah, I've been in here several times. You guys haven't done jack shit. And that's very true. We've gone into the ER several times. They'll give her an injection of Benadryl and said, well, when you're at home, take Benadryl. That is their solution. They had, and follow up with your regular doctor. We follow up the regular doctor. Doctor picks his brain. He's a younger doctor and stuff and everything, but he can't come up with any solutions. We try a bunch of different stuff, and he suggests a bunch of different stuff. Nothing pans out at all. And he's like, you need to see a specialist. But the specialist is booked 6 to 8 months out, or a year out, or whatever. So we finally get in and see the specialist. The specialist looks at an MRI that's already been read and says, oh, look, there's issues. And she goes and gets a CT of this. Oh, look, there's issues. That's kind of weird. The general doctors and the general staff, whatever. So, anyways, that's frustrating. But it is what it is. And she ends up getting put on a much stronger antibiotic, and they're going to go in and clean and seal and grind out. And so I'm just kind of frustrated. I work at that hospital. I work on the clinical side. Just recently, I used to work maintenance, and I work on medical equipment. So I don't deal with patients directly. I deal with equipment that deals with patients directly. And I really try to minimize my exposure to the doctors, whether I talk to them for anything. Most of them, I don't know. They have social problems. They can't talk to you and can't say hi. They're just, I don't know. I don't understand. But I don't want to say get too much because I don't want to get fired. I'm not going to say who it is, where it is, when it is, but whatever. So, anyways, that was kind of my rant. It went way long, 50 minutes. I think my last video I told you I was going to do a video on some responses to the Mandela effect. So I think I'm going to stop it here and do another live stream on the Mandela effect stuff, flat earth stuff, hollow earth stuff, round the globe stuff, and all the videos I watch on there because I spend a ridiculous amount of time on YouTube. So to the one person watching, thanks for watching. And that could be me. I don't know how the software works. I could be the only person watching and I'm watching myself, which is kind of weird, but whatever. So I'm going to try doing these live streams more often. I might even change my cameras out so I'm not on potato vision and set up some better lighting. But live streams are pretty new to me. So anyways, like, share, subscribe. Oh, since this is a long video anyways, and most of you aren't going to watch to the end, I have an Etsy store. I've got like 100 people to view it, mostly from Facebook and YouTube. So I appreciate you going over there and checking stuff out. Nobody's bought anything. I don't think I'm asking too much for the stuff I make. It's handmade quality stuff. So I'll just show some of it here. So this is a walnut. This is horrible lighting and detail, but this is a walnut and oak pipe, oak stem, walnut, food grade mineral oil, and beeswax finish. Another pipe I made. This is a long stem pipe. This is, I just have the little deals in here for Etsy. This is how much it weighs. This is walnut. This is walnut. This is all one piece. And this is a chamber. It's made in two pieces. And then this is an oak stem. The stems are made in 4 pieces in a glue up and then turned around. They're hollow. These do not have replaceable tips on them, but they're still fully functioning pipes. You can watch here. You can kind of see the paper move around. Anyways, I have these for sale on my Etsy store. This is a even longer stem pipe. This is hard maple, and this is oak. It's flat. It's not round, and it's a bigger bowl. It'd hold more volume. A little bit bigger air channel. See, it fully functional. I don't smoke, so I don't know how functional. This is a walnut bowl that I made. My lighting in here doesn't do it justice. It's got a pretty decent finish. It's got a little bit of wear on it. Just been sitting around in my living room forever. I could definitely clean it up before it's sold. Small applewood dish. This has got so far everything else I've shown you is a beeswax mineral oil blend I made that I finished that with. So it's food grade, kinda, as much as food grade is food grade. This is I believe a lacquer finish or shellac finish. Supposedly when it's cured, it's food grade as well. You know, none of this is going to be dishwasher safe or anything, but it's all handmade, hand turned. This one I actually engraved with my laser engraver, my small one. It's kind of cool. And this is a maple goblet, a spalted maple goblet I made. I don't know if it's got much spalting, but it's got some really nice figure in it. It does have a natural crack here, which I did not fill. Just kind of left it alone. This has got a lacquer finish on the outside, nice and shiny. On the inside, it's a beeswax mineral oil finish. This whole thing weighs 8 ounces. doesn't hold 8 ounces, it weighs 8 ounces. I don't remember. At one point I figured out what the volume was, but the info is in the card. I got the Etsy store in my card. I also have another little goblet I made for sale, and I'm going to be putting out more wood turning videos and stuff on there. I might fire the forge up and blacksmith some stuff. I have a titanium bottle opener that people keep telling me I need to make, and so I just use it for my beer and pop. Other than that, this video is almost an hour. That's kind of ridiculously long. So like, share, and subscribe. And I'm going to add some end cards. Let me get centered here. I'm going to add some end cards and some info later, so you can like and share and subscribe and check out other videos and all that other stuff. And thanks, guys. I also have a Patreon account that I'm not super active on, but I don't have anyone supporting me. I don't have anyone that's bought anything, so I only have I'm up to 1,402 subscribers, which is awesome. Thank you, guys. I know I don't put out regular content, and it's not content rich, but I'd like to change that. And if I could spend more time doing this and get some support, I could put more time in it. Whatever. It's another argument for another day. So I'm going to end this now before it gets crazy long. Bye-bye. I just got to figure out how to stop this. Stop streaming.